One of the most remarkable achievements in modern medicine is the development of the blood transfusion. In the United States alone, more than 36,000 transfusions are performed every single day, saving lives in hospitals, emergency rooms, and battlefields alike. Yet what many people do not realize is that the process we now take for granted was made possible by the pioneering work of a Black man. His name, Charles Drew. Born in 1904 in Washington, D.C., Charles Drew excelled in athletics and academics. After earning his medical degree from McGill University in Canada, he returned to the United States, where racial barriers often overshadowed Black talent. But Drew's determination was unstoppable. During the late 1930s, Dr. Charles Drew pioneered techniques to process and preserve blood plasma, an innovation that extended its shelf life and made large-scale blood transfusions possible. His groundbreaking work led to the creation of the first major blood bank and the American Red Cross blood program, saving countless soldiers and civilians during World War II. When the Red Cross, following federal policy, insisted on segregating blood by race, Drew strongly objected and publicly criticized the practice as unscientific and discriminatory. In protest, he resigned in 1941 from his position as medical director of the Red Cross Blood Bank program. He publicly condemned the policy, declaring that there is no scientific reason to differentiate between blood on the basis of race or color. He continued his academic and surgical career at Howard University, where he trained many future Black physicians and surgeons. In time, he became the first Black examiner for the American Board of Surgery and trained a generation of Black physicians. In 1950, after attending a meeting at Tuskegee Institute in Alabama, Dr. Drew fell asleep at the wheel while driving back to Washington, D.C., causing a fatal car accident. His injuries were extensive, and among other things, he needed a blood transfusion. The accident occurred in North Carolina, in the Jim Crow South. Like most Southern states, separate but equal customs were in effect, and in North Carolina, Blacks were not allowed to be treated in the same hospitals as whites. But he was taken to a white hospital, and rumor has it that he was denied a blood transfusion because he was Black. His injuries were extensive, and at the age of 45, he died. Today, because he is recognized as a brilliant physician and American hero, efforts may have been made to sanitize the fact that he was denied a blood transfusion because he was Black. When American history speaks of his death, we are taught that his injuries were too intensive for him to survive, and that he did, in fact, receive a blood transfusion. But consider this: under North Carolina's Jim Crow laws, Black and white patients were required to be treated in separate hospitals or wards. Anyone, especially white doctors or staff, who defied that segregation custom risked powerful social penalties, community ostracism, loss of employment, and professional discipline. Yet, we are expected to believe that though he was only passing through North Carolina, the doctors recognized him and decided to ignore the threat of community chastisement and a possible loss of their job for allowing a colored person to lie on a bed used by white patients and receive treatment from white doctors. We are expected to believe that not only did doctors treat him, they gave him a blood transfusion. We are expected to believe that white doctors in a Jim Crow state willingly gave a Black man a blood transfusion, in a state where they have denied treatment to injured Black men many times. The narrative does not add up, yet the enduring urban legend persists that Dr. Charles Drew, the man who pioneered modern methods to preserve blood plasma and made mass transfusions possible, was denied a life-saving transfusion because he was Black. Though the American narrative refutes this repeatedly, this story remains deeply embedded in the collective memory of the Black community. We may never know the truth, but it stretches the imagination to conclude that in the heart of a Jim Crow state, white doctors ignored Charles Drew's skin color and treated him like they would have treated a white patient. Regardless, in life, Charles Drew's brilliance in medicine has saved countless lives. His vision laid the foundation for modern blood banking and transfusion medicine. To learn more, read Dixieland, Tales, Stories, and Anecdotes of Unfiltered Black American History. Available now on Amazon.com.